course, before we do traction, what do we want to do? Wait. No. Heat.
Oh, yeah.
Yeah, we want to warm up the tissues, or some places may choose to warm it up at the same time with the traction. All right. But we're not going to do that today because we're not going to waste time on heat. All right, so let's say that the heat is off or the tissues are warm and we're doing that. So body weight, now we won't necessarily weigh them. They may not have a scale, and just ask them what their weight is. Hopefully they really know what it is. All right, so get your body weight from your person right now. How much you weigh? Now, here's the thing. I need your weight to help me pull appropriately for the traction on the machine. Just don't ask somebody how much you weigh out of the blue, and they don't know why you're asking. In order to pull for the traction appropriately, I'm going to need your weight. We're going to take half of that weight, take off about 20 additional pounds, and that's going to help us to pull the right amount of pounds to help your back. That's why you want to ask. So try to get the pounds, get half of that, and then get a minus 20.
300?
300. Do you see me how to get 300? No.
300?
They're going to have to say loud.
Good. All right, you got to wait?
270.
Y'all finished? Y'all got to finish number?
270.
Did they ask you?
No, you got to finish number that we want.
Yeah, that's the weight, not my weight.
What's the finish? You got to finish number 1.
500. I'm doing it myself. I'm not doing it.
270.
I don't know.
So, now, with these guys over here, it's going to be different. Why is it going to be different with them?
It's not separate.
They don't have a split. So,
There's no
I don't know what
separate?
their number is.
There's no split.
We're
Let's
using
say-
this.
Let's say that their finished number. Let's say that their finished number was 60. Okay. That would be the number that you would do for
That's
these
what
machines.
you're going to use.
All right. But over here, we have to take 25% of this. 25% of 60. 15. All right. So 15. So the start pounds would be 75 if this was your ending number. Now, so take your ending number and get 25% of that. What's your ending number?
115.
That's your finished number? You already took off your 20?
Yes.
Okay, so what's 25% of that? Most likely it's 25 for a 12, 16, probably like 27, 28 maybe.
28.
29.
So that would be what you would start with. Now, since today we haven't really given any heat, we don't want to pull cold muscle. So let's not do that, but we know how to do it.
Okay.
All right, so let's do like 80 pounds.
Okay.
All right, what was your finish number?
Where's my mom?
We haven't given any heat, so we want cold muscle. What's your finish number? All right, let's do 50. Since we don't have any, we didn't use heat yet, so I'm going to pull a cold muscle. All right, now, let's go with the belts now. All right, now, we're going to put the belt on the patient first. All right, we're going to put the belt on the patient first. Where does this top ridge go?
To the
Oh, yeah, correct. Which belt is supposed to be the tightest?
The top one.
Top belt. And then we're going to put the straps here come from what? These back straps. Ischial tuberosity. Now, so, go ahead and put this on your person in standing. You can do it standing or sitting. Or supine, but we're going to work on it on standing today. However, Marco's diagnosis, according to what's in the lab manual, we'll look at that later, is HMP. HMP, what do we don't want to do for this person?
flexion.
Flexion. Right, so we don't want to do this. Okay, so you can treat an HMP person one of two ways. You can treat them supine with the legs straight or prone. Okay, so we're going to work on prone today. Now, what part of the table corresponds anatomically to my back? Iliac crest or L4, L5 goes to the split. All right, so that's where you would want the person to lay if they were laying supine. If I want to correspond to the split laying prone, what part anatomically could lay right at the split? The navel. So the navel could go in the split. Now, how do we put this belt on? So you're going to have the patient hold it like this here, and they're going to step in. And then you're going to do all the ties from the back, even with the thoracic. They're going to step in. Then they're going to get in the bed, and you're going to make sure that the navel lays at the split.
That's just very prone.
That's if you do it in prone. But we're doing it in prone because your diagnosis for this today is HMP. Everybody else's diagnosis is chronic pain, stiffness, tightness. Say it again. You're going to get some belt on today. All right, so you go ahead and put that belt on. Everybody else go ahead and put on the belt the regular way with the buckles in the front. And tighten up the best you can. That's only for them. When you get to this table, you'll do that.
Where?
Spray it. We need the friction. Hello? We need the friction. Spray the table.
Oh,
Yeah.
What is it? Not too tight.
You probably could tighter. It's not like tighten the front all
Yeah, we're going to get it greater once you lay it down.
Oh.
All right, so let's go ahead and put on the top belt now. All right, just go ahead and put the belt on around the. There you go. And then make sure your back straps are coming from the ischial tuberosity, so you can see the straps here on the side. So we got to scoop this belt.
Am I on backwards?
No. This is the belt you need.
Belt that I need.
What?
Stick it
What
on.
was this one?
It's too hard to explain right now.
Do you want the straps in the back or in the front?
For her, it's going to be in the front, but it's appropriate for her. It's appropriate for her. All right, go put that on. I explained it in open letter. All right, good. Now, you see these? That's going to pull back there. So you want this to pull right here on the ischial tuberosity in the back.
All right. You want to secure back here? For
Right, no. You're good. And we'll scoop these.
Is it like curvier ones or something?
No, it's crisscross for when you do the prone person.
Good question. Does it matter which strap on the back?
It does if you're laying prone. It has to go in the back. You're going to be laying on them. Yeah. All right, good. Now let's look at the thoracic. Which belt is the tightest? Bottom. Which strap, or where do these straps go? Over the acromion. Good. The top belt should be where? This belt. This should, below the xiphoid process. Good. We want this to be the tightest. We want these, or these to be at 8, 9, and 10 on the side. All right, go ahead and put that on. Put it on just like you're doing a parachute or something. All right, so just going to put that on. There you go. Just put the arm in. Yes. And then you want want that to be right on both sides. Remember, you don't want to boost the edge. Now, you're not putting on yours backwards because these guys are different.
Oh, backwards?
They are doing theirs backwards, not you.
Okay.
I don't know what you're doing.
And me?
Yeah.
There you go. So you want to have her hold that right there for you.
Yeah, I was
There you go.
trying to get a hold of it.
There you go. Okay. Yep. Good, good, good. Now remember, when the patient lays down, their feet will face the machine. All right, so that when they lay their head down,
That's the one that's right.
Can we get a pillow?
when they lay their head down, you're always going to lay your head down away from the machine. All right. Now, you got to help them lay down because they're in pain. All right, so you have to help them lay down when they're in pain. And you want to try as much as possible, if you have this table or that table, to get L4, L5 to lay at the split. So see if you can get that going.
We need a pillow or no?
No. So you can just go ahead and help her lay down. You probably won't want to go the other way.
Head away from it.
Right, head away, so lay this way. And then help her bring her legs around. And you see that this is the navel, so you already know that she's going to have to squeeze. Yeah.
Your belly button right on the side.
Would be in pain. Yes. How they would lay down first, and then scoop the legs up, and then around. All right, so see if you think that this is the navel. I think you still probably need to come down a little bit. All right, now, if a person's in pain like these guys here, you want to always keep the... You're not stepping in on these, just over there. All right, we want to always keep the legs bent. All right, so always keep the legs bent. Eventually, we'll put the stool underneath. We want to keep the back nice and flat. All right, now, before we start strapping down... Not yet. You good. Before we start strapping down, make sure that the person is at the split, number one. Number two, make sure that they're in the center. So make sure you might have to slide them one way or the other. But don't ask them to move by themselves. All right? So if they need to move right or left, see where that is.
How do you have to move right along?
I can say, okay, we're going to move to this side over here. Let's move together. We'll move to this side over here. Let's move together. That's how you do it. You good? All right, now we want to tighten the belts. We want to tighten the belts. It's good to pull towards the belt. So you want to come over here and push the belts over away from you. Push away from you, push the belts away from you. And then when I tighten, I want to hold this part of the belt, because sometimes if you do that, you're pushing the teeth into the strap. So that you hold here and pull. Get some feedback from her about how heavy or tight it is.
No,
Not yet. You don't want to do that one yet. That's last. These are first. Yeah, you want to do these first. So let's scoop down.
Is it okay?
That good?
Bottom one okay?
All right, we want to go over there because it's going to be easier to pull. The way to stretch. Is that okay? All right, so you want to say.
That's pretty good.
So you want to hold the belt right here with one hand. Which hand would you prefer to pull with? That hand. So hold the belt with this hand. And pull with that one. Now you want to watch your face here, tongue come out of it. Now this one doesn't have to be as tight, but you know you need to do this one too. But this is the one that really needs to be tight. And then same thing here. Now hold on. Buckles. Remember, there's buckles. We want to do something with the the buckle, so you might want to put something underneath.
Actually, can you loosen it a little bit?
Which one? This one?
Yeah. Yeah, it's right there, the bottom of it.
There you go. Okay.
Yeah, I mean, she's taking over the
You might even have to
a lot of times too.
do
I
that.
think we're doing evaluations, so like,
This stuff, the tension.
that would be weird for a while, whatever.
Same thing. You just go.
How many CIs did you have?
Yep.
I've seen yours, but yeah.
Yeah, she's mine, but.
All right. So how we doing?
Bitch, are we allowed to have a funeral?
You can have a small one. Yeah.
I'm doing a
All right. Now, Tyler. Okay. Make sure that this one down some more. Down, down. You want to
I had a couple questions, but I was like,
ribs.
cut this short.
Yeah, I did too. Everyone, was telling me, all an ass is better.
All right, look over for 1 second. If you have the prone protocol and you step in the belts, you don't need a spreader bar. All right, so we're just going to pull right here. You're going to just do your attachment right here. Just going to do your pull. Because it wouldn't make sense to put a spreader bar. Now look at your angle. So you definitely want to bring that down. All right. Now, since everybody else has the belts coming from the side, we need a spreader bar. All right. But before we do the spreader bar, we need to make sure that we put the legs up. Remember, the legs supposed to stay bent because this person we want to keep the lordosis in the back. So keep the legs bent. Put the straps off to the side. Good, like you have it. Good. And you and he lift together. All right. All right, let's do. On the bowl, let's put this under the legs for hygiene for her calf. Yeah. All right, good. Now let's tighten the top one. Go ahead and tighten the top. All right, so D-ring there, D-ring. Got some underneath here. Let's see if you can tighten
Yeah, I didn't even watch. The guy who was one patient. Oh, yeah, because he said 30 people.
She covered you up. That's nice. That's good. That's good. All right, then you might have to spread it out just a little bit so you do some squeeze.
Ties the end of horses and then some ways.
Anybody in?
You talking to me? Oh, medieval times.
All right, just pull up and it should tighten. Keep pulling. You want this to be nice and hard. Yeah, you just pull hard from the bottom. It should stay tight.
You had some
You should pull up.
I need like not.
There you go.
Oh, yeah.
Across the cone.
I mean, it's only in, Alpha's South.
There you go. Pull tight, tight. Yeah. See somehow. Yeah. There it is. All right. Now let's get the one down the bottom. Got his front yet? Right there.
I like
All right, put your spreader bar on. Now check your angle. You think, yeah. If you think about this here, that's already way more than. Yeah.
I mean, he always tells me, whatever I say, he teaches me,
Right here.
and so,
Put the one on the other side. here.
somebody outside.
The D-ring.
I think it'd be nice right there.
Ah, good.
Cool, I feel. Hey, you're not listening to me.
All right, let's, question. Watch this for a second. Let's look over here. We don't have a high-low bed. How? We're not going to fix it today. How do we get this person to zero? We don't have a high-low bed. And that portable unit doesn't go down anymore. Under the patient. Good. So we would have to bring this person up. More pillows under the bring this person up. That'll bring them to zero. Good.
So can we do it before we get it?
Right. Exactly. All right, now let's see if we can put the parameters in. All right. Now over here, this person is going to be static.
Unlock it now.
Unlock it now before we start here, but not you. So go ahead and put your parameters in. Yeah, we won't press. I don't think you plugged up. Let's see if we can. I hope you're gonna reach somewhere.
What do we have? Just spasm? Is it a
Might reach
diagnosis?
here.
Yeah.
Say it again.
It's just spasm? That's what we have?
Pads.
Spasm.
Spasm. Yeah. So it's just an intermittent protocol for you. Ah, yeah. Spasm, pain, something like that. Let's see. You are on. This is portable. Yes, you have pain. They have spasm. Line straight. All right, so you're number 3.
Wake up.
You don't need it for that. Yeah. So these wouldn't even work for that. You have no static, and that's all you would need to do. So you got the button. All right.
Could you just throw a hot pack on top of all this?
You could. It's just that you have to realize how much is really going to actually make it through.
That best is
all
not
that.
tight now.
You sure could.
The best is not tight
You
enough.
definitely could.
Okay.
It's tight. I didn't supposed to be my partner.
And then what did we say for him?
You evil man.
50 pounds? What did we say? All right. So what's the intermittent people first? What's the on-off time?
40.
40?
40,
10. Good. And treatment time is 10. All right. And then the pounds we said for you to use is 80. This is 50 over here. I think we said, how many pounds we said for you? 40? 44. Okay.
Is that okay to do now?
Oh, yeah, perfect. 'Cause
I'm saying because I'm on.
oh, yeah. Now, the key is, you just do a little pre-check and say, can you reach that, ma'am? Is that okay? You're okay with it? Yeah. And then you do it.
So I only hit that. That's too much.
Remember, you have 50, that says 15. Good. Then you just put everything in again, even though you see it. So you press
Only that.
3. Good. Now, you already did that?
Yeah.
Okay, and then you did your intermittent. Okay, and then you did your time. What's 50%? So about 25. That way he wouldn't have to go all the way down to 0.
Question.
Yes, sir.
I mean, I think you want to do
We can put the hot pad in this spot right here. Right, because you would just lay on it. We just have to be real mindful of the layers with this. Are we putting too many towels because this is so thick? Are we not putting enough towels because this is so thick? So we have to be mindful of that. Right. That's correct.
So I didn't hear. Still on protocol, you wanted to do the hot pack first
You got it.
before we put the bell on them and everything.
You said the bell? The belt.
The
Yes.
belt,
Yeah, that's correct. It depends on if they can really sit in that position with a long period of time, having that. Because if you're sitting, remember your back is stretched. If you're you're sitting like that. Yeah. All right, give him the switch. You know, if you have any increased numbness, increased tingling, increased pain, do that. All right, let's go ahead and let's see. Let the person know you're gonna cut the machine on them. Now, over here. Uh-oh. Oh, you got to start over. You got to stop it and start it and press everything all over again.
Did you start already?
Something got hit by mistake.
So
Take it off. Take it back on.
you guys see like
All right, then punch everything in.
Something,
Yes.
the machine doesn't want to.
Yeah, I'm coming. Okay, over here. When do we split the table for a static protocol?
rest.
No.
As a
Before we cut it
Yeah.
off. So we split the table, then we press start. All right. For you guys, when do we split the table?
The rest.
On the rest time
of the third word.
of the max.
Of the max.
Max
Yeah,
pull.
pull,
Good,
yeah.
good. All right, let me see what you got. Go ahead now.
155.
154.
Oh, for him now.
And
Yeah, hold
that's
on.
the belt. The belt is not tight enough. Pull it.
Yeah, I saw that. Yeah. had it.
So I'll be up on that.
One
That
eight.
makes
Yeah,
sense.
you are. It's an outpatient nurse? Yeah. Oh, it is.
All right, then what about your steps?
Patient. Don't press it now. Okay? If you feel something, feel him. Okay.
All right, and then. All right, let's see. Okay, get some feedback. You can go ahead and cover if you want. Get some feedback from your patient. Just let them know. Get ready to cut it on and cut it on. We unlock it. She did. You don't want her to unlock it. You want her. So I locked it back. She unlocked it. All right, now look underneath to see what it looks like. See what you're locking and unlocking. You see it? Good. Excellent. Okay, that's good. We on?
Alright.
Okay.
I'm going to cut this off, alright?
And nothing else for you to do because there's no split table.
Okay.
If it was over here, then on the rest,
She going to feel something.
she should feel a nice stretch and pull.
Not good.
Hmm? Well, that was probably the first pull. Like about 3,
Yeah.
first pull. And to keep pulling. And remember, it's 40-second hold time. Yeah, it's a long time.
So the things you can stand with.
I can push right down.
Well, this is static, so it's
Okay, we got the concept?
yeah.
Good. All right, let's cut them off.
I want to feel good.
Yeah?
No time.
You didn't cut it. It didn't work.
You feel it? Yeah. Let's not pull it. Maybe the weight is too small.
She actually weak.
Okay, oh. Did you lock the table back?
Sorry, I was getting tired of sitting
Oh,
right there.
Remember, you want to lock the table first, because if a person pops up like that and the table is jiggly, yeah.
Yeah, you get me in trouble.
Oh.
So this is the rest time.
This is the rest time.
Yeah, if we're using the
You got to
table,
go
then
first step, you don't want first. And 40 seconds is a long time.
are you writing in my book?
Yeah, so it's on step 2. And you got longer.
Oh my God.
Okay.
This is good.
You guys are going to go to that machine over there. Neil, you're going to do Marco. Just like they're doing over there.
We're going to that machine?
Yes. And that is DX number 3 over there. DX number 1. So that's 41.
When are they,
Okay, y'all go ahead and cut that off. You can take her out.
oops.
Yeah, with it straight up, it will be unlocked. With it straight down, it will. So, yeah, that's unlocked. Good. All right, we can go ahead and cut them off. But before we do, we want to lock the table back. So turn it straight down. Good. And then you can just go ahead and pick the off of it. All right, then you can have to take them out. Put this away. You'll have to. This will probably be the thing you want to get unloose if you can. You know how to unloose that. Pull it down this way.
How long have you been where you are?
That's where I got my volunteer was at.
Wow.
So, like, when I started here, he kind of just had, he was like, hey, do you want to come in for a little while and make some money? I was like, yeah, sure.
Go ahead and do that then.
Now it's like, he'll just kind of text me every once in a while.
Like an on-call kind of thing?
Yeah.
Have you been there long? Or you just
Yeah,
started?
so like a year. Not even really. Yeah. I mean, like, I had no clue about any of the inpatient stuff that we do here. Now to get in, you have to get, I
To
think,
get in
this program. Yeah, I think you have to get like 25 hours of in and outpatient. Which I think would, I mean, it's helpful for people that don't know what the hell they're getting into.
Well, that's what I mean. Whenever obviously we're all done, there's the board and all that stuff. I want to work in inpatient.
You do?
Like in a hospital. I know it's been a lot. I want to do that and then eventually move to outpatient. But I want to start off in inpatient just because you learn a lot more.
Yeah. I mean, I guess I'm going to do that too. I mean, everyone says, like, start out at a hospital. And apparently, where you're going is where, like, all the money's at.
Good Sam?
Yeah, it's in their city center.
Okay, this is what we're going to do. Now we need to go to groups of 3 for time. So, Celia?
Yes, sir.
No. Not Celia.
Bola?
No, because there's no. Yes, that's fine. Celia, you're going to be with this group right here.
Okay.
Bola, you're going to be with this group right here. You guys, we're going right here to this table right here. So just get your book. And we're going to be on page 41.
Are we all getting our books, or are we setting someone up?
Yeah, you all going to be on there on page 41, doing DX number 3. Celia and Nelia is treating Marco. They're treating Marco.
What people are we doing?
Same DX, but you're going to get the treat now.
Okay.
Yeah.
Oh, you want?
Are we going to go down to number 4? How do you determine, in that letter 4A, how do you determine how to position the patient for traction? How do we figure out
If
where to
the
put the patient?
dick is what's wrong?
Yeah, so why if the patient is H&P, we want to put him prone? That's correct.
Because we don't use foot. They need more flexion.
Keep going. We don't want more flexion.
it's,
the gel is gonna be.
Right. So the gel is going to be pushed out.
Yeah.
Remember, y'all doing that table right there. No. You're going to do this next. Y'all doing that one right there.
Does that mean he has to be prone in here too?
No. You're still doing the same DX. Yeah.
Oh, wait, so we're doing
3.
Oh, 3.
Three.
Okay, we should.
Okay, where is the pelvic belt applied anatomically?
the belly button.
No, over the
Iliac.
Iliac crest.
Iliac crest. Okay, keep
And
going.
the prone is gonna be on what body.
That's where the body will be positioned. We just talking about the belt. So the top part of the belt is going to be at the iliac crest. What else?
and the top one will be right under the xiphoid person.
Pelvic belt is the
Oh,
big belt.
Pelvic.
Pelvic,
Oh, that's
okay,
what
okay.
ischial
Yeah.
tuberosity down.
Ischial tuberosity. What about it? Good.
Yeah.
That's
The
the
strap.
rope.
The
Well,
back strap.
the back strap,
is
yeah.
ischial tuberosity.
Issue.
All right, and then one more thing with the pelvic belt.
The top one is gonna be tight.
Yeah.
Marco, you're the patient. Okay.
Yeah.
Y'all got a few minutes before I'm coming to y'all too.
The top is gonna be tight.
Yeah, the
Yeah,
top
there we
part
go.
is
Good.
gonna be tight.
All right, where is the thoracic belt applied anatomically?
Let me just right under the xiphoid process.
Below the inside.
Okay, which one?
They up.
The top one.
The top
The
belt
top
below the
belt.
xiphoid process.
Yeah.
All right, keep going. What else?
And the strap should be on the arm.
Strap,
Acromion.
acromion. Okay.
And
What else?
the lower one should be the tightest.
The lower one is the tightest.
Tightest.
One more thing.
And the part should be on the 8, 9, and 10
There we go.
ribs.
Good. Good. Okay. What part of the body should correspond to the split in the table?
That's the alpha.
The iliac.
L4, L5,
Yeah.
iliac crest, same thing. That's if you're supine.
The supine is,
You're
I don't know
prone.
the name of
Navel.
the
Navel.
Okay, good. How should the legs be positioned when the person is supine?
I'm already halfway there.
Straight.
The legs
Without-
It depends.
straight.
Okay, so let's say, probably need to add to this question. If the person has HMP and they're supine,
Straight.
Straight without
Okay.
stone.
If the person has low back pain and they're supine,
That would be flex.
With the
with the
Flex
stool.
with a
with these
stool.
two.
Yeah,
It's
so
stiffness,
supine with the stool.
okay.
So depend on the DX.
Okay.
All right. What should be the angle of pull?
The first 3 months should be 0.
0 to
0 to
5.
10.
0 to 10. Good.
More,
Keep it-
more,
first treatment, stay
more
closer
closer to 0, yeah.
When do you open the table for intermittent?
For
The beginning.
intermediate or
As the rest of the
Other
third,
Rest of
of
the
the
last.
rest of the
Okay,
last,
just in case somebody do
last
4
four.
steps
Okay,
or
other-
2 steps.
yeah. The rest
All right.
time.
What about for static?
Open
At the
before you
beginning.
cut
At
the
the beginning.
machine.
Before you cut the machine. Okay. What is the advantage of treating on a split table? All right. So what's the advantage of me using this table versus me using that table?
It gives more stretch.
More stretch. Why?
Because the table more.
Less
less time.
friction.
friction.
Yeah.
Less friction. Good. All right. How should you instruct the patient to get off the table with supine? So,
You roll,
you gonna tell me to get
roll,
off?
roll to
You
the
roll
side
to the
and
side.
push up with your elbow.
Sideline.
Good. Now, what if I'm prone?
You're prone.
Roll to the
Sideline.
side.
All right. Let me show you this. All right, so let's say I had this one, and you unhook the buckles. Okay. Had the person do this.
Not really.
Okay.
It's
And
easy.
then let the belts fall to the floor. Let the patient step out. You pick the belts up, but don't make them
Yeah.
do that. Good. All right.
I think we missed one.
Do we skip one?
What is the purpose of thoracic belt? Did we do that?
Oh, counter traction. So if let's say that's the pelvic belt, and this is the thoracic. If this is the pelvic belt, and the pelvic belt is just pulling, and that's all that's going to happen. If the pelvic belt pulls that way, and the thoracic belt pulls this way, I get counter traction.
Counter traction.
I get traction against the other. Yeah.
Right.
Okay, guys, we got to go to Miss Sonia at 10 o'clock.
119.
And I still need to get you guys over here.
What weight are we using?
Okay, now let's go to biofeedback. All right, we're going to go to.
Should be 119. But we're not using 119.
We'll be doing it next week too. All right, 62. So here is the unit. Okay. Everybody can really play patient. All right, so Mikhail, once you set up the machine, so here is electrode.
Sorry, he doesn't step
Battery.
in, does he?
There.
No. No, he doesn't step in.
He's going
Alright, now, we're going to go by what it says on 62. Then you're going to put put this in one of these, put it into letter A. You see letter A? There you go. Let's keep this back on.
Is it too high?
Kind of like a slide, something like that.
Sorry, it's probably touching you like that.
Yeah, it is.
Here.
Good. All right, we're done with that. All right, we're looking at letter B on page 62. Snap channel A and delete. Good. Select a muscle to re-educate. Now, I tried my forearm this morning, but I think it was just so much hair. I don't know how much hair y'all got. So let's maybe try the bicep. We're going to try the bicep today. All right. Prepare skin. Clean with alcohol. All right, so you can clean yourself today. You don't clean your patient, but clean yourself today. All right.
Can you buy it? The bottom one? How to help you get on with it? Okay?
I'm sorry.
Okay?
No problem. I'm sorry, it has to be pink. Smaller won't mind, but you know, brothers might have a fit. Now, remember, we can either use the emery board or the stone that somebody would use on their foot. So just go ahead and use the board. All right. So while we're doing the board, what are we doing here? We're trying to really get the skin prepped for that. Yeah, good friction to the skin, so that the electrodes can really sense what's going on. Good. So we're clean. Good. Now. Okay. Now, a gel on your electrode. So just dab, dab, dab. Then it says go ahead and take it off. Take the paper off the thing. See how you get it? There you go. Good. Get it right there on your arm. This is your treatment area. Yeah. Sure. Good. All right,
Okay.
Miguel, since you're first, we're going to go ahead and treat you. So go ahead and get it snapped in there. Should be snap, snap, snap. Perfect. Good. All right, now we're going to read and we're going to do Mikhail first. Maybe you can turn it so we all can see. All right. Then it says press the on button. The on button is that red button there. And then we'll do the battery. If it's in there right. Make sure your battery's in there correct. Yeah, I'm thinking it's the battery position. Check the position.
More. Yeah, a little more. That's good.
It's not going Sorry.
Okay. You got it? Okay. You put the number in?
Try it. Good. Okay, good. All right, then press OK for channel A. So I think